Hello dear students, welcome back to my YouTube channel Physiology Learning. We are continuing with our ECG series. Today we are going to discuss one of the most important topic in the whole of ECG series, that is the ECG Wave Generation. Why this is the most important topic is because once you understand this concept of generation of waves and how and what is the reason for those waves and the physiological concepts behind them, it is easier for us to go through the other concepts and easily understand the abnormalities also. So make sure that you watch this video completely so that you can understand the rest of the ECG series. So let's get into the topic. So first, before going into the wave generation, we have to understand a little bit concept about the voltmeter. So ECG is a modified voltmeter. So what it is going to record is, it is going to give us a magnitude and direction. What do I mean by that? So direction means whether the ECG wave is going towards the positive electrode or it is going away from the positive electrode. So the direction can be positive direction or it can be a negative deflection also. Next thing is, it will give us the magnitude. Magnitude means it will give us the amplitude of the wave, whether the wave is smaller or whether the wave is larger. How is it determined? This is determined, the magnitude is determined based on the size of the muscle. Suppose if there is a smaller tissue, then obviously the wave generated will be smaller. If there is a little more larger tissue, the wave that is generated by this tissue will be a little larger. So the size of the tissue will determine the amplitude. And the direction will be determined based on the positive moving towards a positive or it is moving away from the positive. So the direction, I will tell you how the direction it is given by the voltmeter. So in general, if there is a recording, what it will have is, it will have a voltmeter and there will be an indicator, and one direction will be positive recordings, +1, +2, +3, like that, and another side it will be the negative deflection, -1, -2, -3, like that. So it is giving both the direction, whether it is positive, as well as the amplitude, whether it is 1, 2, 3, something like that. So now with this concept, we'll try to understand when a positive deflection will be recorded and when a negative deflection will be recorded. So everything, all the terminals will have one negative terminal and one positive terminal. In our lead construction also, we have done the same. One will be a negative terminal and another will be a positive terminal. In a unipolar lead, the positive terminal is nothing but the exploring electrode. So in a unipolar lead, the positive terminal is the exploring electrode. So all of us know that at baseline, the resting membrane potential or the inside of the tissue is in a negativity. And whenever any impulse is given or the SA node itself fires. So all of you make sure that you watch the conduction system of the heart before watching this video. Why? Because this the conduction system we have told from SA node where it goes and what all the process happens. So whenever an impulse from an SA node is generated and it is making the stimulus. So what will happen? These waves will turn into positive. And now in this example, whatever I have given, here the positivity is moving towards a positive terminal. So here the positive waves are moving towards a positive terminal. So my deflection will also be positive. So my deflection also will be positive. Now in the second scenario, let's take if the negative charges are moving towards the negative terminal like this, in this direction. The negative charges are moving towards the negative terminal. So what happens in this condition? In this condition also, the deflection is going to be positive. Why is it so? Because whenever the charges are moving towards the specific electrode, for example, the negative charges are moving towards the negative electrode, then the deflection will be positive. If the positive charges are moving towards positive or the negative charges are moving towards negative, then the circuit is in a complete proper connection. So the deflection will be positive in case of both. Whereas the reverse, for example, the negative charges are moving towards the positive electrode. If negative charges are moving towards the positive electrode or positive charges are moving towards the negative electrode, in both these conditions, what will happen is, in both this condition, the deflection is going to be negative. The deflection is going to be negative. So you can simply remember like a mathematical formula also. In maths also we study plus into plus will give a plus, positive deflection. Minus into minus will also give a plus. Whereas the reverse, plus it moves towards minus or minus it moves towards plus. In both these cases, the deflection is going to be negative. Please recap this and see this, watch this part. Why? Because this is one of the most important concept, and this will help us understand why some of the waves are positive, why some of the waves are negative. So plus into plus is plus and minus into minus is also plus. So with this concept, now we will try to move on to the ECG wave generation. And we have to understand one more simple concept, like suppose for example a tissue is there and it is completely depolarized. Completely depolarized means all of the tissue is positive. So what is going to happen? At this given point of time, let's imagine like all of the tissue has become positive. At this given point of time, there will be no current flow. There will be no current flow. So the voltmeter is not going to show any recording. It is going to be a flat line. So when the tissue is completely depolarized or the other way, completely repolarized. For example, it is completely negative, then also there will be no current flow and the deflection will be a flat line. So why does it happen? Because the voltmeter will record the change in potential. If the change is not there, if entire tissue is completely depolarized, then also there will be no recording, or if the entire tissue is completely repolarized, then also there will be no recording. So with all this knowledge, now we will try to understand the concept of ECG wave generation. All of us already in the history itself we saw there the waves are named as PQRST waves. And there are some additional waves, but these are the major waves which we generally find in all the ECGs. Then the most preferred lead to record an ECG and read an ECG to begin with is lead 2. We have seen 12 leads, but why I am specifying that it is a lead 2 through which we can analyze most of the things. Of course, we will analyze all the leads, but for a general concept, the lead 2 is the one which is preferred. Why is it so? There is all logic behind that. If you remember that lead 2 was attached between the right arm and the left leg. The lead 2 was attached between the right arm and the left leg. And the direction of the heart, the direction of the SA node firing also is in this direction. So that is why the lead 2 is the most preferred lead to record and observe the findings. And the other leads will be supporting and helping the lead 2 and making a conclusion from other leads. So to begin with, in the lead 2, the right arm is negative and the left leg is positive. So this is the lead attachment, and now we will try to understand what happens when the SA node starts to fire and the impulses spread, how will be our recording. So to begin with, the SA node is the one which is firing. It will fire the impulse to both the atria, both the right atria and the left atria. So what will happen? Initially it was negative, now the charges are becoming positive. Now, what is this positive charges are called as? These minute positive charges are called as instantaneous vectors. Instantaneous vectors. But obviously, the ECG is not going to record all of them. What it is going to do is, it is going to summate all of them and give one recording. So that vector is called as mean vector. This mean vector has two things. One is the charge and the direction. So the SA node is firing. So this is directed towards the left leg. So this will be the positive charge and it is directed towards the left leg. And this vector, which is the summation of all of them, is called as the mean vector. This is called as the mean vector. Now tell me which charge is moving towards where. Here you can see that the positive charges are moving towards the positive direction. So what will be the deflection? The deflection also will be positive. That gives rises to the P wave. That gives rises to the P wave. Many of the people study PQRST system like P wave is radial depolarization, PQRS complex is ventricular depolarization, and T wave is repolarization. Do not study like that. It was generated from the SA node and the waves have started firing and they have created the wave. So first understand how the generation happened, then how the wave was created. Now tell me, the P wave is positive because the positive charges were moving towards the positive electrode, so the deflection is positive. And will the P wave will be smaller or larger? It will be smaller. Why? Because is the atrial muscle. The atrial muscle is small in comparison to the ventricle. So that is the reason for P wave. Now after the P wave, what will happen? Now the P wave, all the atria is fired, and after that it cannot directly enter the ventricle. It has to go through a node that is called as the AV node. We have also known that this AV node is the one which is acting like a gatekeeper. It is acting like a gatekeeper. So what will happen? So whatever impulse which is generated from the SA node, they will charge the atria. But whenever it goes, it has to pass through the ventricle. It has to first go through the AV node and then the ventricle. And all of us know AV node has one property which is called as AV nodal delay. AV nodal delay. So what will happen in the AV nodal delay? AV nodal delay, the AV node keeps the impulse with itself. It is not sending it to the next ventricle. It will wait for some time so that the atrial contraction can happen and the blood can be emptied. So at this point of time, the AV node is keeping the impulse with itself. So in the recording, we will not see any deflection. There will be a flat line. So as you can see here, we have already gotten our P wave above, and after the P wave, there will be a flat line. This segment is called as PR segment. And why is this segment happening? It is happening because of the AV nodal delay. AV nodal delay. Whereas the P wave was happening due to the atrial depolarization. Now coming to the next. Now once it has reached the ventricle, after that, once it has reached to the AV node, after that it is going to go to the bundle of His. So it is going to go to the bundle of His. From the bundle, we have the left and right branches. The right and left bundle branches will go and they will help to charge the ventricles. From the AV node, the bundle of His will come and then the right and left branches. And finally, the Purkinje fibers will come and they will charge it. And next, the ventricular depolarization will happen. The ventricular depolarization does not happen in one go. It happens in three steps. It happens in three different steps. What are these three different steps? These three different steps. First is the fibers will go like this. Please concentrate at this area. The fibers are going like this. Now it is giving fibers. The right and left bundle branch is giving the fibers to this particular region, which is called as the interventricular septum. It is called as the interventricular septum. It is not charging the entire ventricle in one go. That is important. The interventricular septum. Why this interventricular septum alone it is giving? Because the fiber arrangement is there and it charges faster. Now these are positive charges because it's a depolarizing wave. This positive charge, where it is going, it is giving in this direction. So this positive charges are moving towards the negative terminal. So the deflection will be negative. Even though the depolarization is a positive wave, but still they are moving, the septal depolarization is moving towards the negative terminal. So that is why the Q wave is negative. Lot of you people must have drawn the QRS complex. In that the Q wave is drawn negatively. Why? Because is here the positive waves are moving towards a negative deflection. And next, and many of you must not have known the reason. Everybody would have drawn the QRS complex, but the primary reason is it's not the entire depolarization happening. It is the ventricular septal depolarization. Then after that, what happens? Then after that, the fibers starts to fire the major portion of the ventricle. They are giving fibers like this and they are charging the major ventricle. So we have just got the Q wave. Then after that, the major ventricle is getting depolarized. In this, many of the instantaneous vector are pointing towards this direction. But all of us know the left ventricle is the major ventricle, so the mean vector will be directed and pulled towards by the left ventricle. giving it a positive charge. Here, the positive charges are moving towards the positive terminal. So how will be the deflection? The deflection will be positive. So this is step 1. In our step 2, the deflection is coming positive because the positive waves are moving towards the positive direction, and it is bigger. Why it is bigger? Because the ventricular musculature is bigger, and that is why the wave is also bigger. So that wave is nothing but a R wave. Then after that, now we have charged the interventricular septum. Now we have charged the major ventricle. But as you can see here, I have not charged or drawn plus signs near the base. The base will be separately. Finally, at the end, the fibers go like this, and they will give impulse to the base. As you can see here, the direction of this fibers, the Purkinje fibers, is in the opposite direction. So here the positive charges are moving towards the negative terminal. So initially in the septum also the fibers were going like this. For the base also the fibers are going like this. Already we had our Q wave and we had our R wave. Now what is happening? Now the fibers on the basal region are giving the S wave. And as you can see here, it is negative. Why it is negative? Because it is moving away from the positive or towards the negative electrode. S wave. So all of us try to understand that QRS complex is not one ventricular depolarization in one go. It happens in 3 phases. The Q wave is nothing but the septal depolarization, interventricular septal depolarization. Whereas R wave is called as major ventricular depolarization. Whereas S wave is nothing but the basal ventricular depolarization. So that is why Q wave and S wave is negative, whereas the R wave is positive. All of the activity is depolarization, but it is just the wave which is moving in different direction is creating such a scenario. Now after this, what happens is, now the ventricular septum is also depolarized. The major ventricles is also depolarized. Everything is happening in a rapid, it's not that slow that. So the major ventricle is also depolarized. Then the basal is also depolarized. Now all the ventricle is completely depolarized. If all the ventricle is completely depolarized, do you think any charges is moving? Obviously the answer is no. So what is going to happen? Now all is depolarized. It is a state of complete depolarization. We already discussed that whenever it is completely depolarized, it is going to have a flat line. So now after the QRS complex, what is going to happen? There will be a flat line. This segment is called as ST segment. So ST segment. So that is why the ST segment is a flat line, because of the complete depolarization. Then after the depolarization happened, now the ventricle is completely charged. What is going to happen? The repolarization process is going to start. Now we are going to start with our repolarization. And there are a few things to note down. All of us know that repolarization is becoming negative or coming back again to the negative stage. So the repolarization in a cardiac muscle, it starts from the apex and it moves towards the base. So it is starting from the apex and moving towards the base. And as you can see here, it is moving in this direction. These are negative waves which are going again to the negative terminal. So negative is going towards the negative. So what will be my deflection? My deflection is going to be positive. That is why the T wave's deflection is positive. T wave, this is one of the common give reason question that is also asked. T wave, even though it is a repolarization wave, still it is positive. Why it is positive? There are several reasons. First thing is the depolarization happens from apex to base. Next thing is the negative charges are moving towards the negative terminal. Next thing is it happens from the epicardium to the endocardium. Imagine it like from the outside the charges are moving towards inside. So it is moving towards the negative terminal. So it happens from the epicardium to endocardium. So these are the reasons. And next thing is why it is happening from the outside to inside. Some of the reason that is suggested is, here during the ventricular depolarization, after the ventricular depolarization, the contraction happens and the blood supply inside the musculature is compromised. Only the blood supply, that is the outside, is available for the ion exchange and channel opening. So that is why it happens from the epicardium towards the endocardium and from the apex to the base. It is because the supply of the blood is available on the outside predominantly that repolation starts from outside and it moves inside. Whereas the Purkinje fibers, they fire from inside, from the endocardium to the epicardium. So the depolarization, if you talk about, it happens from endo to epicardium. Endocardium to the epicardium. Whereas here it is happening from epicardium to the endocardium. Now we are done with our T wave also. Then after the T wave, what happens? The all of ventricular muscle has become repolarized now. Do we have anything recording in the recording? We will not have anything. So after the T wave, there will again be a flat line. This segment is called as TP segment. Many of them forgot to mention about this TP segment. Why? Because this TP is the preceding the next, the P wave. So after this TP segment, what is going to happen? Now ventricular activity is completely gone. Now again the SA node is going to fire and it is going to charge the atria, which is going to create a next P wave. So next P wave will be created. So the T wave will be a little larger and next P wave will be created. So this is the T wave, this is the P wave, and the segment between them is nothing but TP segment, which happens because of complete repolarization. So this led us to the generation of P wave, QRS complex, T wave, and the segments that we have discussed. And there are a few points to think about. You can drop it in the comment section. I have not mentioned any wave for atrial repolarization. We saw atrial depolarization, ventricular depolarization, ventricular repolarization. Where is the wave of atrial repolarization? You can drop it in the comment section and I will be happy to pin the correct answer in the comment section. And why is the T wave smaller than the QRS complex? Whenever we are drawing the QRS complex, as you can see here, the QRS complex is taller and the T wave is smaller. Why is it so? The T wave's height is smaller. Why is it so? Because why I am asking this question is, the QRS complex is also done by the same musculature, that is the ventricular muscle, whereas the T wave is also done by the same musculature. Both these questions I would like you to answer in the comment section, and the correct answers I will try to pin it in the comment sections. So QRS complex and T wave, why the height of T wave is not as large as the QRS complex, and where is our atrial repolarization gone? So a small recap. I want you guys to pay attention to this recap because we are going to write specifically what is the activity happening. So first, this wave is nothing but the P wave, and P wave is because of what? It is because of atrial depolarization. Next thing is this segment, PR segment. Why we are saying PR segment rather than PQ segment is, in some of the ECG leads, some of the times the Q wave is not recorded. Like the Q wave can be absent in some of the leads. So that's why this name is given. PR segment is due to AV nodal delay. This is important. Next, we are going to write the individual wave, the Q wave. The Q wave is due to what? The Q wave is due to septal depolarization. Whereas the R wave is due to major ventricular depolarization. And the S wave is due to basal depolarization. Here they might ask you, why is the Q wave negative, why is the S wave negative, or why is the T wave positive? All these are probable questions. Then what is this segment? ST segment. So this ST segment is nothing but our complete, when the ventricle is completely depolarized, we will get the ST wave. Then this T wave is due to ventricular repolarization. And this segment, last segment, that is the TP segment is nothing but when completely repolarized. There also we are not going to get any wave, it is going to be a flat line. This is very, very, very important to realize it, because all the abnormalities you can understand with the help of this diagram. Then a short recap. The waves means any deflection is called as waves. Deflection in wave pattern. So what are the waves we saw? We saw the P wave, QRS complex and the T wave. Then flat lines we saw PR segment, ST segment, TP segment. Then intervals are nothing but they will have a wave as well as a segment component. PR interval, then QT interval, then RR interval. RR interval means from one point of the same region we are going to the another point. So this is an indicator of one heartbeat, or we can say it is the indicator of one cardiac cycle. So this is all about the wave generation, and all the waves on all the directions we saw how they will appear in the lead 2. If you want to study and understand how they appear in the lead 3 or any other lead, then I will make a separate video for it and showing that how the waves normally appear in other leads. Why they will appear differently in other leads? Because the other leads are capturing the heart from a different angle. So that is why they will appear differently in other leads. So I hope it's clear. Thank you for watching the video. Subscribe to the channel for more such videos. Thank you so much.